today is very important. We are dealing with JVP and its abnormalities. So before we start, let's just picture the JVP and how it looks. So this is a sample of how the graph looks. So this is roughly the diagram of JVP. So this is A, next comes C. So AC and XYV. Okay, it's easy. AC, XY, V. So this we need to memorize this graph as we are continuing to discuss. So now we are starting with some A, that is we are going to look at the A wave. So the A wave, it corresponds to the atrial contraction. So A wave is nothing but the atrial contraction. So now when we look at the abnormalities, so abnormalities here we are looking at prominent A waves. So prominent A waves. So the prominent A waves, it takes place in conditions such as the pulmonary hypertension. Next it is seen in right atrial thrombus. So pulmonary hypertension, right atrial thrombus or mass you can tell, and the tricuspid stenosis and also the tricuspid stenosis. Next we move on to the canon A waves. Canon A waves. So what are these canon A waves? So canon A waves, when you look at the condition, it takes place in the complete AV block. See, C and C. So it is complete AV block. And also the ventricular tachycardia. Then there is also the premature atrial and the junctional ventricular beats. Premature atrial and the junctional ventricular beats. Next we'll move on to the absent A waves. So when you look at the absent A waves, the condition is nothing but the atrial fibrillation. This is the absent A waves is seen in atrial fibrillation. Now we are going to look at the C wave. So the C wave, if you see, it corresponds to the bulging of the tricuspid valve. So C wave means the bulging of the tricuspid. So bulging of the tricuspid valve. And where does it bulge? It bulges into the right atrium, and this is during ventricular contraction. Next what we see is there is a X descent. So there is a X descent and it corresponds to the atrial relaxation. And this is during the atrial diastole. So this is during the atrial diastole. Now let's focus on some abnormalities. So the abnormality here is when you look at, there is an absent X descent. So an absent X descent is found in case of the severe tricuspid regurgitation. Then when we look at the rapid, so in case of the rapid X descent, it includes the cardiac tamponade. Now we will look at the V wave. So the V wave, it corresponds to the V for venous filling. So V for venous filling, and this is of the right atrium. So what is the abnormality in this case? So there is a dominant V wave. So dominant V wave. So what does this infer? So it means there is a tricuspid regurgitation. Next we are going to look at the Y wave. So the wide descent. So the wide descent, it is nothing but it corresponds to the passive emptying. It corresponds to the passive emptying, and this is of the right atrium into the right ventricle. So right atrium into the right ventricle. So let's look at the abnormalities. So there is a prolonged wide descent, and this prolonged wide descent, the condition here is that there is a tricuspid stenosis. This is in case of prolonged wide descent. Then when we look at the rapid wide descent. So the rapid wide descent, it refers to the constructive pericarditis. Constructive pericarditis as well as the isolated severe tricuspid regurgitation. Next, we will look at a condition that is in case of absent wide descent. So in terms of the absent wide descent, so here it is seen in case of the cardiac tamponade. So this was about the regular JVP, how it looks, and we have also discussed some abnormalities in each wave. So to learn and grow daily like this, please do subscribe.